everyone, I am Dr. Roshi Satija, and today we'll be talking about what is IVF. IVF, or in vitro fertilization, or test tube baby. We'll be talking about what is the IVF procedure, how it is done, who requires IVF, how much duration does the IVF procedure take, and when does the IVF results come. So IVF, or in vitro fertilization, is a procedure which is done on couples who are unable to conceive. Normally the fertilization procedure happens in the fallopian tube in the lady, where the egg and sperm fuse. This procedure is performed in the embryology lab in IVF. Who requires IVF? Not all couples who are planning to conceive or trying to conceive require IVF. If a lady is advanced age, if a couple has been married for a very long time, if the lady's both fallopian tubes are blocked, if she has fibroids, endometriosis, or polycystic ovarian syndrome. In case of male partner, if they have sperms which are of poor quality, the morphology or the form of the sperm is not good, the motility is not good, the count is very less or almost nil, or if both the partners have all the reports normal but still they are not able to conceive, which is called unexplained infertility, they also require IVF. Now, what happens in this IVF procedure? The couple comes to God's Grace IVF Center OPD, where a proper counseling session is given to the couple, which involves doctor consultation, where proper history is taken, reports are analyzed, blood analysis, semen test, ultrasound are done, counseling is given to the couple, and then a proper protocol is done for the couple so that we have a high success rate. Once this part is done, then begins the proper IVF procedure, wherein normally the lady is called on the second day of her cycle based on the protocol planned. There she is given egg-forming high dose of injections or the treatment based on the protocol. These injections are egg-forming. They are given for 10 to 12 days. In this span of 10 to 12 days, ultrasound, follicle monitoring, and blood investigations are done. A proper counseling and consultation is also done during this span. Once the eggs are big and mature, then a trigger injection is given, and 35 hours later, the lady is called fasting to God's Grace IVF Center ward, wherein she is asked for fasting for 6 to 8 hours. Then she is taken to the OT, where anesthesia is given to the lady, and with the help of an ultrasound, the eggs which were formed in the ovary are taken out. These eggs are held with the holding. We have a very high magnifying microscope which gives us a very high success rate. This egg is held with the holding and the sperms are taken in the injection. The egg and sperm are fused with the help of the ICSI procedure, which increases our success rate from 60 to 80%. Now, after this procedure, the baby or the embryo starts growing in the embryology lab. In the lab, the embryo grows from day 0 to day 5. Day 5 is considered as the best quality embryo or the blastocyst embryo. The implantation rate or the success rate depends entirely on the quality of the oocyte, sperm, and the blastocyst which is formed. After the blastocyst which is formed, if it's a fresh transfer cycle, the embryo is transferred on the same day. Else, the lady is called for a frozen embryo transfer. That is, a lady is given a relaxing period. After that, the endometrial lining is formed, and then this embryo is transferred into the womb of the lady. Once the embryo is transferred, after 14 days comes the pregnancy result. The pregnancy test is done with the help of a blood test called beta-HCG. If the result is positive, it is good news. Else, if the lady had more number of embryos formed, we have a procedure of embryo freezing as well. The embryos are frozen. Those embryos are used in the consecutive cycles if she doesn't conceive. Protocols are changed so that we are able to give her a good success rate and help her get pregnant. So this is the entire procedure of IVF. This procedure takes approximately 4 to 6 weeks. So today we've spoken about in vitro fertilization or IVF. If you want to know anything about this procedure, you can contact us. Our details are enclosed. We'd be very happy to help you. Thank you.